Hello, dear students. Welcome back to your channel, I Love Pharmacology. In today's session, let us learn pharmacology through comics. So, here you're going to see two characters which will be depicting the two drugs. And these two characters will going to talk between each other and will learn the drug information through their conversation. So, this way of learning would make fun and you'll be able to understand the pharmacology topics in a easier way. So, let's start PharmaCOMICology. So, here is a story where the Metformin will going to meet the Acarbose. So Metformin will date the Acarbose. So let's see how the conversation will go on. So here you can see that Metformin will going to introduce to the Acarbose. So he is introducing himself as Metformin, and also Acarbose reacts to Metformin saying hello, and she will going to say her name Acarbose. So let's see how this conversation will go on. Okay, here the Metformin will going to introduce from where he comes from. So Metformin family is bigonoids. Metformin belongs to the family of bigonoids, whereas the Acarbose introduces herself as alpha glucosidase inhibitor family. So she says that she's a Acarbose and she belongs to alpha glucosidase inhibitor family. So next what happens is the Metformin will going to tell about their siblings. So Metformin says that under the family of bigonoids, Metformin doesn't have any brothers or sisters. So Metformin does not have any brothers as well as sisters. Whereas the Acarbose is very happy to share that the alpha glucosidase inhibitor has got siblings. So Acarbose has got two brothers. So two brother names are Mellitus and Voglibose. So then Metformin thinks how to become close with the Mellitus and Voglibose, so that he can marry Acarbose. Metformin can marry Acarbose only if he becomes close to Mellitus and Voglibose. So next what happens is in the conversation, so Acarbose will ask whether Metformin is doing some job or not. So Metformin says he's doing a job of decreasing the hepatic glucose production. So please remember, Metformin job is to decrease the hepatic glucose production. And Metformin will going to ask Acarbose what Acarbose is doing and what is her job. So Acarbose reveals that she has a job of decreasing the gastrointestinal glucose absorption. Then both are happy because both are going to decrease the blood glucose levels. Though they have got different roles, their goal is to decrease the glucose levels in the blood. So Metformin job is to decrease the hepatic glucose production, whereas Acarbose job is to decrease the gastrointestinal glucose absorption. So next what happens is this metformin will going to introduce Acarbose with the metformin advantages. So metformin has got an advantage of it can be advantage in three forms. Metformin can reduce the weight, or it can maintain the weight neutral, and there won't be any hypoglycemic episodes following the administration of metformin. And also the metformin will going to reduce the cardiovascular event. Apart from this, metformin is usually accepted very well by the patients. So let's see who are the patients for metformin. So whereas the Acarbose, she says that I have also have got the advantage. So my advantage is Acarbose will going to decrease the postprandial glycemia. That means they're going to decrease the increase in the blood glucose level following the intake of the meal. So Acarbose has got advantage in decreasing the postprandial glycemia. So next what happens is metformin, after telling the advantages, he will tell that I am used for treatment of diabetes mellitus. Since I have got all these advantages and I reduces the hepatic glucose production, I can be used in the treatment of diabetes mellitus, and I am serving many of the diabetic patient. Similarly, the Acarbose will going to say that she is also helping hand to hand in the treatment of diabetes mellitus. So both metformin as well as Acarbose are beneficial in the treatment of diabetes mellitus. So this metformin as well as Acarbose are the good friends for diabetics patients. Next, they want to discuss about their bad things. What metformin can do to the diabetic patient. So metformin says, so I can cause diarrhea as a side effect. I can cause nausea. I can cause lactic acidosis, but it is rare. And it can also cause vitamin B12 deficiency. So these are the bad things about the metformin. So if a diabetic patient consumes metformin, it can cause diarrhea, it can cause nausea, it can cause lactic acidosis, it can cause vitamin B12 deficiency. On the other hand, the Acarbose bad thing is since it decreases the GI glucose absorption, it will going to have a bad effect on the GIT. It will cause gastrointestinal flatulence. So please remember here the metformin is causing lactic acidosis as well as vitamin B12 deficiency, whereas Acarbose is causing gastrointestinal flatulence, GI side effects. So then they will also discuss about their contraindication, where have no role in some of the conditions. So metformin should not be used if there is a renal insufficiency. If a patient is having renal insufficiency, metformin should not be given. And also GFR, if it is less than 45 ml per minute, then metformin is contraindicated. And also Acarbose says she cannot be used if a patient is having any renal or liver diseases. These are the contraindications. Then the metformin says when the diabetic patients consumes metformin, there will be reduction of glycated hemoglobin levels. There will be reduction of glycated hemoglobin levels, that is HbA1c by 1 to 2%. 1 to 2%. So HbA1c will tell about the average of the blood glucose levels which are maintained in the previous 3 months. Similarly, the Acarbose will say that I am also going to decrease the HbA1c levels, but I am not decreasing the HbA1c levels as much as metformin will do. So Acarbose will decrease the HbA1c level by 0.5 to 0.8%. 0.5 to 0.8%. So metformin is very happy that he is going to decrease the HbA1c level more compared to the Acarbose. Then metformin lastly tells Acarbose that I am the most commonly used oral hypoglycemic agent because it is available very easily and it is available at very low cost. With low cost, maximum benefits and minimal side effects. Whereas Acarbose is also a good drug, whereas the cost is little bit more than that of the metformin. So patient acceptability wise, so metformin is more commonly chosen, and also Acarbose will also be accepted by the patient except for GI side effects. The cost wise, metformin is low and little bit costlier is the Acarbose when compared to metformin. So this was about the drug information about the metformin and the Acarbose in the form of comics. I hope you have enjoyed this learning process. If you like this video, please do subscribe to my channel, I Love Pharmacology, and do not forget to share and hit the like button for more updates on pharmacology. Thank you.